Why can't dentists provide a normal service during the pandemic?
There's really two reasons why they can't. One is to make sure that there's enough PPE to go around. The second reason is because of the aerosols that maybe are produced by a lot of the treatments that maybe a dentist may be able to do. So whether we're using drills or whether we're washing a tooth and what have you sort of thing, there's an aerosol there. So we are trying to make sure that we reduce the spread of the virus. So we're trying to protect staff, other patients and the wider community.
If dentists have personal protective equipment, can they carry out these procedures?
The supply of PPE, as we've all heard on the news and various media, is restricted significantly. It's basically hard to get PPE, and the urgent dental care centres have been able to source sufficient quantities of PPE. This PPE is required for the protection of the dental staff and dentists and their dental nurses. And as I say, this PPE is not yet available to dentists in their own practices.
What can my dentist do for me if I'm in pain?
Dentists may give advice. They may examine the patient and treat the patient. They may offer analgesics such as painkillers, antibiotics, or simply advice, as I say, or they may examine the patient and provide some simple forms of treatment, treatment that doesn't involve an aerosol, therefore doesn't involve a drill, doesn't involve the mist associated with the drill. These types of treatment can be provided, such as simple extractions, or the dentist may refer the patient under certain conditions to one of the urgent dental care clinics that have been set up across Northern Ireland.
I've heard you can only get extractions, not fillings or root canal treatment at these urgent dental care centres.
The role of the urgent dental care clinics set up across Northern Ireland are to address the following issues. Firstly, severe pain, bleeding, infection, trauma or swelling. Extraction or root canal treatment may be provided, but the extraction will control pain, infection and swelling more predictably than root canal treatment.
If you were getting a root treatment, normally it would either be finished on the day or within a week or 2 weeks down the line. So again, we cannot finish it, and it will be some time before you will be able to get back into your own dentist to get the root treatment finished, and you can't come back into us to get it finished. So if it's not fully completed, there's more chance of it flaring back up again. So it may mean that some teeth, particularly maybe at the back, are maybe more likely to be extracted during COVID times than maybe would have been during normal times.
I don't want to have an extraction, but I'm in pain. What are my options?
There can be a number of options. Your dentist knows you, knows your circumstances, knows your dentition, your mouth better than anyone else. So again, that is a conversation that you have with your own dentist prior to any referral to the urgent dental clinic.